Hello everybody, my name is Sarah Tanner. This presentation is for DEH 30270, Research Methodology with instructor Alicia Anaya. This presentation is a plea to ask dental professionals and the dental community as a whole to consider adding occlusal guards as a form of standard of care. The current prognosis and the method of treating bruxism is through signs of damage, irreversible damage at that, to natural dentition, restorative work, and TMJ-associated structures. My question is, why wait for the damage to occur? Why not place patients from post-ortho treatment to as old as 101 years old into an occlusal guard before the damage occurs? The body is affected by everyday living. We see that in blood pressure, the nervous system, the muscular system. Why are we once again failing to think about the dentition and TMJ-associated structures? Many things can cause an individual to damage their teeth, as is listed here. According to the American Dental Association, 95% of Americans have symptoms of bruxism throughout their life. And isn't that the case? And who's to say what they're doing during the day, and are they stopping themselves? Are they educated to know to stop themselves? And what are they doing at nighttime, which is when the most force is being emitted without conscious effect of saying, hey, probably shouldn't do that. So as dental professionals, I am asking, let's be forthcoming. Let's be a step ahead of the irreversible damage and be preventative in a way we know that works, and that's through an occlusal guard. Establishing the standard of care is important, not only chairside as an office, but as a community. A plea for a development of a universal accepted molar tooth wear evaluation system is quite complex. I won't ask dental professionals to do that. I'm asking for more of a simpler kind of method of establishing care, and that's, for instance, dental hygienists sitting chairside and looking at the big picture and noticing types of medications that patients might be in, lifestyle situations, stresses they might be going through, restorative work that this patient currently has, then going and collaborating with the dentist and possibly the office staff to establish a protocol for the office. For example, our office many years ago started recommending a occlusal guard for patients with implants in order to prevent failure of an implant. Today, we are considering recommending occlusal guards to those patients with several root canal teeth, because we are starting to see that aging root canal treated teeth are starting to get root fractures. And as we know, with a root canal tooth and root fractures, the inevitable of extraction is a must. And that's unfortunate, since we are trying to prevent extraction of any tooth because we know how vital each and every tooth is. Affordability is the main deterrent as to why patients aren't following through with treatment. I think the collaboration between the dentist, hygienist, and insurance companies needs to happen in order for this affordability impairment to subside. Already registered dental hygienists with private practices can possibly establish a written letter of agreement with the dentist that they work with. This dentist would then demonstrate and state that he trusts this hygienist to diagnose, to treat, and prevent bruxism. We all know that as dental hygienists, we are unable to remove tooth structure. but can we remove structure of the anatomy on a plastic occlusal guard with care? And that again is in collaboration with a dentist at the patient's 6-month recare to make sure that things are okay. This, of course, cannot happen until state legislation to increase the scope of practice can be permitted for dental hygienists to diagnose, to treat, and prevent bruxism. In the state of Colorado, we are unable as dental hygienists to do such a thing. And I think that by allowing us those privileges to diagnose, treat, and prevent would reduce the cost of an occlusal guard. Amazon and copycat companies understand the interest in prevention and know how expensive it is. They are doing what we should be doing, but we in turn would make it a safe option. We'd be monitoring them, and it would be the approved method of treatment versus an unknown form of treatment. Even Dr. Seuss thinks that teeth are always in style. Thank you for your time.